Hey guys, it's Dr. Ozzie Rodas here at High Desert Dental in the beautiful city of Albuquerque, New Mexico. And today we're taking you through the steps involved for a dental implant consultation and dental implant placement. So the first thing that you'll do is you'll walk through those doors and you'll meet one of our friendly front team members, and they're gonna hand you a COVID-19 questionnaire, take your temperature, and also give you a health history form. After you finish filling out your health history form, one of our lovely assistants will call you back and take a 3D scan. After these things are completed, I will walk into the room and start my consultation. I will first review your health history to make sure that you're a good candidate for an implant placement, and then I will review your scan. In this scan, you can see that there is a lot of bone, width and height. And then the other thing that I look for is also, especially for the lower implants, is the amount of space that we have from the base of the bone to that inferior alveolar nerve as marked here in this image. I've determined the appropriate size and length for this dental implant so that we can get the appropriate stability and emergence profile of the implant crown. So after all of that has been reviewed and we find that you're a good candidate, we will then schedule you for the actual implant placement surgery. And during this procedure, we will either start with giving you some oral sedation medication if you choose, or IV sedation. In this case, this patient decided to be awake. We first start by placing some numbing jelly so that you'll be comfortable during the anesthetic delivery. And after the area is nice and numb, we'll start to make a small incision and prepare the site for the implant using a series of drill sequences as shown in the image above. After the area has been prepared for the implant, I then will place the implant, and the most important thing is that we get primary stability or initial stability of that implant, which we luckily did. And then here's a final scan of the implant placed in that lower left side. A little back information for this patient: they had been missing this tooth for about a year. They did get a bone graft and it healed nicely. And after this placement, we'll then have a 2-week follow-up to make sure that she does not have an infection. And as long as everything looks clear, then we'll allow the implant to integrate. It's called osseointegration, so it helps the area heal together and your bone will anchor it into place. And then we will schedule for a 3-month appointment so that we can start taking the impressions. We'll be posting a video about dental implant impressions soon. If you have any questions, go ahead and ask them below. Otherwise, hit the thumbs up button, share it to your family and friends. We'll be putting out some more content, more videos about dental implants. I hope you enjoyed this video. Again, this is Dr. Ozzie Rodas, and we'll talk to you soon.